Genital herpes is a common sexually transmitted infection, or STI, caused by the herpes simplex virus, also known as HSV. There are two types of HSV, HSV1 and HSV2. While both can cause genital herpes, HSV2 is more commonly associated with genital outbreaks. This infection affects people of all ages and backgrounds and is lifelong. However, there are effective ways to manage the symptoms and reduce the risk of transmission. Interestingly, many people with genital herpes may have no symptoms or only mild symptoms, and they may not even know they have the infection. However, it can cause painful sores and blisters in the genital area, which can be uncomfortable and may make it difficult to have sex. In some cases, genital herpes can also lead to more serious complications. Many people with genital herpes experience no symptoms, especially after the first outbreak. Others might notice mild symptoms that could easily be mistaken for other conditions such as a pimple or ingrown hair. However, when symptoms do occur, they can be noticeable and uncomfortable. The most common symptom is the appearance of one or more blisters or sores in the genital area, which can be painful and may itch or burn. These typically appear within a few days to a few weeks after exposure to the virus. Other common symptoms include pain or itching in the genital area, flu-like symptoms such as fever, headache and muscle aches, and swollen lymph nodes in the groin. The first outbreak of genital herpes is usually the most severe, with subsequent outbreaks typically being milder and shorter in duration. Genital herpes is highly contagious and spreads through direct skin-to-skin contact with an infected person. This contact usually occurs during sexual activity, including vaginal, anal, and oral sex. The virus can be spread even when there are no visible sores or blisters. HSV can also be spread through skin-to-skin contact with an infected area, such as a cold sore on the mouth. This is why it's important to avoid sharing personal items like razors or towels with someone who has herpes. It's important to note that HSV can only be spread through direct contact with an infected area, and you cannot get genital herpes from touching objects like toilet seats, bedding, or swimming pools. If you are experiencing symptoms of genital herpes or think you may have been exposed to the virus, it's essential to see a healthcare professional for testing and diagnosis. Early diagnosis and treatment can help manage symptoms, reduce the risk of complications, and prevent transmission to others. A healthcare provider will ask about your medical history and sexual activity, and will also perform a physical exam to look for any signs of herpes. If sores are present, your doctor may take a swab of the sore to test for the presence of HSV. Blood tests can also be used to diagnose herpes. These tests detect antibodies to the virus, which your body produces in response to infection. It's important to note that blood tests cannot distinguish between HSV1 and HSV2. While there is no cure for genital herpes, antiviral medications can help manage the infection and reduce the severity and frequency of outbreaks. These medications work by interfering with the virus's ability to replicate. Antiviral medications for genital herpes are available by prescription only. Your doctor will determine the best treatment plan for you based on several factors, including the severity of your symptoms, your overall health, and whether you have frequent outbreaks. Commonly prescribed antiviral medications for genital herpes include acyclovir, also known as Zovirax, valacyclovir, known as Valtrex, and famciclovir, or Famvir. These medications can be taken at the first sign of an outbreak to shorten its duration and reduce discomfort. Living with genital herpes is manageable with the right information and support. By understanding the virus and taking steps to manage the infection, you can live a healthy and fulfilling life. Long-term management of genital herpes often involves taking antiviral medications daily to suppress the virus and reduce the risk of outbreaks. This is known as suppressive therapy. In addition to medication, there are several lifestyle modifications that can help manage genital herpes. These include avoiding triggers that can cause outbreaks such as stress, fatigue, and illness, practicing good hygiene, such as washing your hands regularly and avoiding touching your genitals unless necessary, and informing your sexual partners about your diagnosis and using condoms consistently to reduce the risk of transmission. If you are pregnant and have genital herpes, it's crucial to inform your healthcare provider. Herpes can be passed from a mother to her baby during childbirth, potentially causing serious complications for the infant. To minimize the risk of transmission during delivery, your doctor may recommend taking antiviral medication during the 3rd trimester of pregnancy. They may also suggest a cesarean section if you have an active outbreak at the time of labor. It's important to discuss your individual situation and risk factors with your healthcare provider. They can provide personalized guidance and recommendations to ensure a safe pregnancy and delivery. Preventing the spread of genital herpes requires open communication, responsible sexual practices, and awareness of the virus. Using condoms consistently and correctly during sexual activity can significantly reduce the risk of transmitting herpes and other STIs. However, it's important to remember that condoms do not provide complete protection, as the virus can be spread through contact with areas not covered by a condom. If you have genital herpes, it's essential to inform your sexual partners about your diagnosis. This allows them to make informed decisions about their sexual health and consider getting tested. Regular STI testing is crucial for anyone who is sexually active, even if they don't have symptoms. Early detection and treatment can prevent complications and reduce the risk of transmission.